In our practice, diagnosis and treatment follow a precise, methodical process. In this video, I will guide you through the key steps we use to evaluate function, select materials, and design a smile that is both durable and naturally elegant. Before designing a new smile, it is essential to understand what is truly happening inside the mouth. Once infection and inflammation have been addressed, we evaluate how the bite functions and how the jaws come together. This allows us to select restorative materials capable of withstanding functional stresses over time. We carefully look for wear patterns that reveal excessive friction between the teeth. When these findings are combined with limited mouth opening, they indicate increased muscular activity and therefore a greater risk of future prosthetic fractures. Today, a significant portion of adults clench or grind their teeth. In such cases, restorations must be fabricated from highly durable materials that remain gentle on already worn or shortened teeth. At this very stage, the management of bacteria and functional forces is complete, and we move into the most creative phase of treatment, the redesigning of the smile. We begin by evaluating the face and the dynamics of the smile, how the lips move, and how much tooth structure is visible. From this analysis, we determine the ideal size and position of the teeth so they appear natural, refined, and harmonious. Through precise measurements and resin mock-ups, we establish the ideal length of the upper front teeth. Once this reference is defined, the remaining teeth can be designed with accuracy and predictability. We then digitally scan the mouth, capture facial photographs, and redesign each tooth using a digital smile design technology. When the design is finalized, the proposed form is transferred to the patient's mouth using prototype mock-ups or laboratory fabricated provisional restorations. This allows us to evaluate both function and aesthetics under real conditions. During this phase, subtle refinements are made while the patient actively participates, sharing what feels natural and comfortable. This collaboration fosters confidence and ensures the final result reflects precisely what the patient needs without compromise. Finally, it is important to emphasize that even when a genetic predisposition exists, consistent daily oral care can lead to remarkable improvement and long-term preservation of oral health. There is no reason to feel discouraged if your gums bleed or if your teeth have fractured unexpectedly in the past. With thorough diagnostic approach and individualized planning, you can receive the treatment that is truly appropriate for you.